Did you know that PCOS affects 7 to 10% of women globally? But you will be shocked to know that Indian women are more prone to PCOS. Some studies indicate that approximately 20% of Indian women suffer from this condition, especially adolescents. Something that I find really sad is that almost 70% of PCOS affected women remain undiagnosed worldwide, with symptoms like irregular menstrual cycles, weight gain, acne, excess facial hair, which over a long term can lead to serious health issues like diabetes, high blood pressure, infertility, and miscarriages if it is left untreated. PCOS can significantly impact a woman's health and quality of life. Hence, managing it effectively becomes absolutely crucial for every woman. The first step to beat PCOS is to learn everything about this lifestyle disorder. Hi, I am Lopamudra Banerjee, a nutritionist and a women's health coach with 14 years of experience. And I have helped thousands of women just like you, not only to manage their PCOS symptoms, but also to live a healthy life. In this video, I'm going to share everything that you need to know about PCOS. First, let's understand what is PCOS and why is PCOS caused. PCOS, Polycystic Ovary Syndrome, is a hormonal imbalance which is caused to women in the reproductive age. The symptoms of PCOS vary from a lot of facial hair, voice change because of high androgen levels, infertility, acne, weight gain. So these are common symptoms which happens because of PCOS. But this is not just an endocrine issue. It also leads to other metabolic disorders, like you will have slow metabolism, your body weight will go high, you will have more bloating, you will also have insulin sensitivity, you will be more susceptible to become pre-diabetic because of PCOS. From 1990 to 2019, the number of PCOS women worldwide has raised to 32 million. So the staggering rise of PCOS that is happening every single year is unbelievable. In fact, 1 in every 10th woman has PCOS. Let's now discuss what causes PCOS. There are 2 main reasons: genetics and lifestyle disorder. Let's talk about genetics. It has been found in research that a woman whose mom, aunt, or sister, they have PCOS, it's more likely that she will also develop PCOS. If mom, sister, or aunt has symptoms of insulin resistance or has high androgen levels in their body, which includes facial hair, male patterned balding, or acne in the face, it has been seen that the female also develops similar things. So those are usually said that it has been transferred through the genes and it is genetic. However, the majority of women suffer with PCOS because of lifestyle disorders. Now, there are 3 very important things which comes under lifestyle disorder. The first one is the kind of diet that you eat. The second one is the kind of activity levels that you have. And third one is how prone you are to obesity. Okay. Now, the diet, as we all know, it's the most important thing for any health goal, whether it is PCOS, weight loss, or anything whatsoever. When it comes to PCOS, it's very, very important that the diet that you are eating has to be low in glycemic index. It has to have more protein, more fat, healthy fat, and fiber. You cannot eat processed carbs or carbs which will spike up your insulin. So stay away from food which has simple carbohydrates like white flour, white rice, pasta, or anything which is processed, like processed meat, processed ready-made food which you have to just microwave, or cereal which has frosted sugar. These are dangerous for people who have PCOS or who have symptoms of PCOS which can lead to PCOS. The second thing which is very important is your activity level. It is very, very important for women who have PCOS or even the symptoms of PCOS to have a lifestyle where they are at least doing 10,000 to 14,000 steps every single day. Because once you do that, your insulin is going to get stabilized. Remember this, majority of women who have PCOS have insulin sensitivity. You need to eat and act according to that. So your diet and your exercise or your daily activity level plays a very important role when it comes to understanding, what and why you are getting PCOS. The third thing, which is another cause, is if obesity runs in the family. If your mom is obese, or your dad is obese, your sisters, your siblings are obese, there are high chances that you are also obese. And if you are obese, you are again susceptible to PCOS or any kind of other inflammatory disorders, right? So these are the causes which leads to PCOS. Now, while I explained you about the causes, let's understand the symptoms. How will you know whether you are susceptible to PCOS or not? What are the symptoms that you need to be careful of? The first symptom that you have to see is weight gain, unnecessary weight gain. You will see that you feel bloated. There is a lot of fat accumulation around your abdominal cavity. That is a symptom that you are insulin resistant, and there are chances that you can become susceptible to PCOS. The second very common symptom that people see is facial hair, acne, or male patterned balding. These are all because of high androgen levels, which again increases because of PCOS. Your hormones are imbalanced. The male hormone, the androgen levels, goes high in the body. And it has also been seen that people develop a voice, a male voice. The voice also changes because of high androgen levels. So that is the second symptom that you will notice apart from weight gain. The third thing, which is again a common symptom, is ovarian cyst. So if you go and do an ultrasound and you find cysts in the body, which is like a straight symptom and a straight thing that you have PCOS, because that itself means that your ovaries have small cysts which contains fluids. Another thing that you will notice is when it comes to losing weight, it's not like very easy for you to lose weight. It's not that you can just eat a calorie deficit diet and you will lose weight. PCOS diet is absolutely different than a regular weight loss diet. You have to make sure that you are eating a PCOS diet if you want to lose weight. Otherwise, losing weight is very, very, very hard. You may lose probably a couple of pounds, but you will again get it back. You will keep having bloating in the body. You will still feel puffy. You will still feel heavy when you wake up in the morning. Another symptom about PCOS is infertility, which is again very common, and I deal with it with so many of my clients all the time. Again, if your hormones are not functioning well, if you don't have your periods properly, there is no ovulation happening, of course there will be infertility. And again, that is a symptom, which means you may have PCOS if you are seeing that it's hard for you to conceive. And lastly, this is the most important and the most common one, is insulin resistance. You do a blood work and you will see that your HbA1c is either elevated or it's borderline. Or you have symptoms of diabetes, constant urination, or your blood sugar fluctuating, wherein you suddenly feel very hungry. Even if you've eaten a whole meal, you will see that you're feeling so hungry that you really need to eat again. Okay, some people may also experience slight burning while urinating. That's again a symptom of diabetes, which is seen in patients who have PCOS. So insulin resistance is one of the most common symptoms for women if you have PCOS, and this particular symptom leads to a lot more things and is basically an obstruction when you are trying to manage your PCOS and when you are trying to fix things with PCOS. Now, some of the unknown symptoms which many people are not aware of because of PCOS are, there is something called acanthosis nigricans. Now, what is it? It is the patches that you see around your shoulders and your armpits. The skin just turns black. That is a symptom of insulin resistance, and it is also a symptom if you have PCOS. Another very uncommon but lesser known symptom is skin tags. You will see you're having skin tags, red skin tags, black skin tags. That's again a symptom that you have PCOS. Again, it is caused by insulin resistance. So insulin resistance is one of the most common symptoms which leads to many of these conditions when you have PCOS. Another very less common symptom which is seen is chronic fatigue. You may sleep, like 6-7 hours in the night, but you will feel so fatigued, so tired throughout the day that you just will not have any energy to do that. You might see that, you are having no motivation in the body. There is no energy in the body. You just don't feel like doing things. So chronic fatigue is again a lesser known symptom, but it is a symptom when you have PCOS. And of course, mood swings. Mood swings and depression are also quite commonly found in women who have PCOS. Okay, so that's again, and of course there are many reasons behind it. Sometimes women find it very hard to lose weight. Even if they are trying hard, they are just not able to lose weight, and which leads to a constant battle with their body image, where they kind of find it hard to accept the weight gain that they have got over a period of time, and it becomes very hard for them to accept it, which leads to irritability or depression. There are two also other symptoms, which I have seen while consulting a lot of people is, as I said, some people do experience male pattern balding. Then there are women who also experience hair thinning. Your hair will suddenly start, the hair strand becomes very, very thin. That's again a symptom of hormonal imbalance, and a lot of times it is PCOS. And lastly, there is another symptom if you have PCOS is pelvic pain. You will see that you just have pain around your pelvic area, just like that. You're walking, you feel there's a pain around your lower abdomen in the pelvic area. You might just have this pain for a couple of days, which remains with you, and it just doesn't go. You just don't understand why it's happening. You may feel that periods are coming, but it will not come. Like how you feel before getting your periods, that kind of pain will be there, but then that pain will not go. It just stays, it remains, and it comes in phases. So that's again a symptom when you have PCOS. So PCOS has like a lot of symptoms, okay? But the major one, as I said, is insulin resistance, acne, male pattern balding. These are the common symptoms which is usually seen. And of course, weight gain and finding it really hard to lose weight. And again, I'm going to say and add it here that if you have PCOS and you are trying to lose weight, you will have to eat a PCOS weight loss diet and not just like a general weight loss diet, because a general weight loss diet will just cut down your calories. However, when it comes to PCOS weight loss, you will have to lose weight, keeping in mind that you're insulin resistant and you also have all those symptoms. So the diet has to have all the macronutrients to make sure that you have that while you are also trying to lose weight. Now, here is another commonly asked question. How can I diagnose that I have PCOS? A valid question. So there are many ways you can get yourself checked if you have PCOS. Of course, the first one is, a physical examination. You will have to go to the doctor, tell the doctor about your symptoms, get a USG scan done and see what is the doctor saying. They will find cystic ovaries, and if that is there, of course you are diagnosed and the doctor confirms that you have PCOS, right? But a lot of times I have also seen that the cysts are not there, but they still have PCOS symptoms. Now, what are those symptoms, and why, how can you diagnose if it is, leading towards PCOS or not? So the symptoms that usually you will see is, as I said, in this video before, that you will see that you have excess hair growth, okay, which is actually called hirsutism. Okay, that's the medical term. It's called hirsutism, which means excess of hair growth. You will have oily skin and a lot of acne on the face. Again, dark patches. As I said, it's called acanthosis nigricans. I don't know whether I'm pronouncing it correctly or not, but then that's what it is called. So I usually call it like black patches, which is very common in patients who have PCOS. So if you see that, that's again a symptom that you may have PCOS. And of course, weight gain and skin tags, and all the other symptoms which I just told you about. So if you see maybe more than one or two symptoms, that may get diagnosed that you have PCOS or you are susceptible to PCOS. Okay. Third thing which can be done, of course, is blood tests. You can always ask your doctor to get some blood work done, and you can check your androgen levels, so you can get your androgen levels checked. You can check your LH and FSH hormone test. LH is luteinizing hormone, so which basically decides when to have periods. So that's something, whether your LH hormone is correct. FSH also, which is again a follicle stimulating hormone, which is very, very important to know, if you have PCOS, it is irregular. So again, blood tests are another way of diagnosing if you have PCOS. There are certain other blood tests also which basically can help you. Of course, you can check your insulin levels and get your HbA1c. HbA1c is basically the marker of what is your insulin levels in the last 3 months. So it gives a diagnosis. If it is somewhat close to 6, you are borderline, and they usually give you the report whether you are borderline diabetic or what does the range say. Another test there is, which you can ask the doctor to do, is it's basically called GTT, which means glucose tolerance test. So this test basically analyzes how your body basically processes sugar. Okay, and this also actually is an indicator which can tell you whether you are susceptible to type 2 diabetes or not. So GTT is again a test. If you see that you have a lot of symptoms, you can ask your doctor to do GTT. Even if you are not having elevated HbA1c or borderline HbA1c, you can still get your GTT checked to see how you process sugar. There are a lot of women post 40, their GTT levels are higher, which basically indicates that they are not able to process the sugar. The insulin is basically not able to stabilize the sugar in the body. Another important blood test is to check your cholesterol and lipid profile. So check, again, because when you have PCOS, you do gain a lot of weight, which can lead to cholesterol or fatty liver. So it's important to get that checked as well, right? So these are the blood tests and yes, one more thing which I forgot to mention is your TSH hormone, your thyroid stimulating hormone, which is again a very common symptom, which comes along with the symptoms of PCOS, or people, a lot of times people who have who are insulin resistant also, they have TSH levels are higher, right? So these are the tests which will basically determine whether you have PCOS, whether you are susceptible to PCOS, and then what are the symptoms. You may have developed symptoms beforehand, and then you finally actually get diagnosed with PCOS where you actually have cystic ovaries. Okay, now I'm going to talk about the misconceptions. And there are a lot of misconceptions about PCOS. People think that if you have PCOS, you cannot become pregnant, you are infertile, or PCOS only affects fertility, and if you have PCOS you will always be overweight. So these are all the myths, okay? So I want to touch base on this as well in this video. Now, it doesn't mean that if you have PCOS, you will be infertile. There are a lot of moms who have PCOS and they have conceived pretty naturally and they do have healthy pregnancy. So it's not that if you have PCOS, you will be infertile or you will find it very hard to conceive, okay? So that's a myth. That you can take it off. Of course, there are a lot of patients who do have infertility issues because of PCOS, but it's not that everybody who has PCOS, will be infertile or it's going to be hard for them to conceive. Okay. The second thing, which is again a very common, and of course it is common, but then it's not that the only thing, this is what happens, is if you have PCOS, you will always be overweight. No, it's not like that. I have clients who are underweight and they have PCOS. Okay. So it's not that if you have PCOS, you will always be overweight. You may be really, really lean and still have PCOS, because PCOS is actually a hormonal imbalance. It has weight gain is a symptom of PCOS. And another common thing that I hear from people is, and they kind of dread about it, is if you have PCOS, the only way to cure that is to take a birth control pill. For this, I will say absolutely wrong, because what does a birth control pill do? It's suppressing your hormone, right? So you're suppressing your hormone so that you don't get your periods regularly. The entire process of ovulation is not happening, and it's basically stopping your periods from coming. And when you're stopping your periods from coming, obviously the cysts are not getting developed, and then you will you are basically trying to manage other symptoms by taking a birth control pill. But birth control pill is not the only solution. Of course, if your doctor has suggested and you have chosen that path of taking birth control pill, it's great, but that's not the only solution. You can control your PCOS naturally by staying consistent with your diet, exercise, and making lifestyle changes. So these are like very, very, very important things when it comes to controlling your PCOS and the common myths that people have. So yes, you need not have birth control pill. You can still manage your PCOS without that, and it doesn't mean that if you have PCOS you will become infertile. No, not at all. You can still have healthy pregnancy with PCOS, and you may be underweight and you can still have PCOS. So these are the common myths which I wanted to touch base when it comes to PCOS. Now, before I end this video, something which I really want to talk about is PCOS solution is not one solution that fits all, okay? PCOS solution is a very customized solution based on each individual, on the symptoms that she is showing, the goals that she has. If someone has PCOS and she wants to conceive, the goal is different, the diet has to be different, the macronutrient that she should be consuming is going to be different, okay? Similarly, if somebody wants to lose weight, it's a different plan altogether. Or you have somebody who just say, I just want to get my periods regularly. Again, it's a different diet and exercise that has to be followed. So the bottom line here, what I want to say is PCOS solution is very, very individualized, and you really need an individual approach when you want to cure your PCOS. You can always manage the symptoms through medication by suppressing one of the symptoms, okay? But that doesn't cure PCOS. PCOS it's like an umbrella, okay? And there are tons of symptoms which falls under it. So you can just stop one symptom, however the rest of the symptoms might stop for the time being, okay? But the moment you stop this medicine, everything is going to come back to square one, and it might even bounce back with higher intensity. So the way to look after the PCOS solution is basically handling this holistically based on your individual requirement, okay? Now in this video, I have only spoken about the diet and exercise, and there are many things that needs to be spoken about PCOS, okay? So this is just the tip of the iceberg. So you have to see the next series, the next video, where I'm going to talk about more in-depth knowledge about other things which actually affects the symptoms of PCOS, or which aggravates the symptoms of PCOS, okay? Lastly, I want to tell you something. Your mom, your grandmom, or anybody, from the previous generation, they did not suffer with PCOS, right? But you are suffering. Why are you suffering? What is the reason that has made you susceptible to this condition? Why do you think that you have PCOS? Let me know in the comment section below.